New Jersey starts receiving the swine flu vaccine next week. Nasal spray will arrive first, followed by the injectable vaccine. Meanwhile, the state health department has unveiled public service announcement it hopes will convince people to get vaccinated. NJN News health and medical correspondent Sarah Lee Kessler reports.
You can do your part to protect yourself and stop the spread of the flu. Get a flu shot.
The PSA campaign was unveiled at the State Health Department's 5th and final Pandemic Flu Preparedness Summit today. Information will be in English and in Spanish. Vaccination is the cornerstone of the fight against the flu, swine or otherwise.
The latest information we have from CDC is that we should begin receiving H1N1 vaccine sometime over the next week, and the first shipment will be in the form of the nasal mist.
Health Commissioner Heather Howard told the group that injectable swine flu vaccine will arrive shortly thereafter in staggered shipments.
We know there will be enough vaccine for everyone, but since it's coming in waves, we want to make sure those most at risk are targeted for those initial shipments.
Priority target groups include pregnant women, children and young adults ages 6 months to 24 years, adults ages 25 to 64 with chronic medical conditions, healthcare and EMS workers, and people who care for infants under 6 months old. Vaccine will be distributed to 2,300 sites in New Jersey.
If you are uninsured, there will be no copay or other fees associated with receiving the H1N1 at our public health clinics.
At the same time people roll up their sleeves for the swine flu shot, the federal government is rolling out an unprecedented system to track possible side effects because the government believes that inevitably there will be false alarms. That was the subject of a front-page New York Times story yesterday. The headline, Swine Flu Officials Message, Don't Blame Shots for All Ills, including over 1 million heart attacks a year, nearly 800,000 strokes, 876,000 miscarriages. Inevitably, some of these will happen within hours or days of a flu shot.
Vaccines are safe and effective. We wouldn't be using them if they were not.
Let's keep ourselves safe and healthy.
Sarah Lee Kessler, NJN News, New Brunswick.